Monthly podcast that we do for Start My Wellness, and we sometimes have live participants. So we'll see if anybody joins to kind of join the conversation. But we do this podcast once a month to cover topics that have to do with mental health, emotional health, physical health, kind of like wellness topics. And this was Bill's suggestion, which I thought was a really good idea, to try to help the audience in our community get to know more of the clinicians that we work with in our own group. So, Alyssa, I appreciate you kind of being willing to participate, to join, and to talk kind of about your professional career path and what you've done in the past, what you're doing now. So, I thought maybe we could start with just kind of getting to know the work that you're. I know you're kind of in a transition phase in your career. You're going to be working more on focusing on psychiatric kind of improving psychiatric symptoms, things like that. So maybe can you share with our audience a little bit about your career path so far and kind of how you got to where you are today?
Sure. And thank you for having me on the podcast. So I was just chatting with Bill offline and saying that it is kind of an interesting intersection where I've been I've come to after doing a couple of different things with my career. And it's kind of led me into this little niche area, of expertise. But I started off as a registered nurse and worked in the hospital in different areas for maybe 5 or 6 years. I worked in orthopedics and oncology, and then ended up on labor and delivery, and decided that I wanted to go back to school to get a midwifery degree. And then worked in Chicago in a private practice in the city for almost 10 years, doing private midwifery, private full scope is what we call it, where we see patients in an outpatient setting, and then deliver their babies in the hospital. And I delivered babies at Northwestern Hospital, and spoke Spanish with my patients. That was just another, kind of big part of my career.
I didn't know
Um,
that. Okay, yeah.
yeah. I worked at a federally qualified health center, which is, where you focus on care for the underserved, and just happened to be in a practice where I had mostly Latina patients.
Hmm.
So, yeah, I did that for 10 years, and was really integrated in that community. My daughter was born there and had a Mexican nanny, and so some of her first words were in Spanish, and we really lived that life. It's different, from the one that we live here, but it was really lovely. And she's since forgotten all of her Spanish, which is very sad. But um, and then moved over here because this is where my family's from, and then worked in a midwifery setting in a hospital, which is a little bit different from full scope. More like a kind of keeping labor and delivery flowing, and um, then became a manager in a hospital of a group of practitioners, and decided that I wanted to go to school at that point. I really thought about it for many years, to go back to school to get a psychiatry certification. But I think when you're working in full scope midwifery, it is extremely busy. You see, 20 in that kind of setting, over 20 patients a day.
Yeah.
Yeah. And then would deliver sometimes 6 babies in a 24-hour period. And
My
just,
gosh.
yeah, couldn't really see how I would be able to fit it in, but it um, was much easier. And, my second job in Michigan as a midwife. And I think what just kind of prompted me to go back to school, I really started thinking about it in Chicago because I just saw so many um, sad things that I just remember feeling that I wish I had more time, or more ability to work on these, issues with these families that are, suffering. And it did seem like, um, they kind of seem like to the average person, like that they're disparate subjects, midwifery and psychiatry and mental health, but they really flow together pretty well.
For sure. No, that makes
Yeah.
sense, and I think we that's a really interesting career kind of arc, and I'm sure Bill, we could ask you a lot of questions there, but one thing that kind of quickly stands out to me is the world of mental health from my vantage point as a therapist, as a psychoanalyst, is you have to be able to combine a thoughtfulness and a knowledge base, like a professional knowledge base, right? With a sort of like an empathic sense of the person's actual life. Like, what does it feel like to be in the world as them or their life experience? And I think your background, working with, helping people give birth and being a Spanish speaker, I think it gives you a sense of the real world, right? You have to be in these situations where real things happen and you have to respond. You have to be present for that. I think that's actually a really useful kind of vantage point from which to try to empathize or understand or kind of get the experience of the other. So that I think that's a really cool, like sometimes we have clinicians who work with us who are, maybe they recently completed graduate school and they're maybe at a different place in their career. They may have a lot of academic instruction, but they may not have this kind of more experiential, they don't know some of those experiences firsthand, so to speak, right? So I think it's really interesting.
Hmm.
Bill, I don't know,
Yeah.
any questions for you? I think we have kind of an idea of some of the topics we want to cover, but I don't know if anything, Bill, you wanted to ask about.
I'm just waiting to hear the rest of the story, actually, at this point. I don't have anything right now. I want to hear what's next.
Right. Well, I think Anton, you summed it up pretty well. I kind of um, feel like or um, want to live my life and show my daughter how to be like a citizen of the world, basically. Like that sort of phrase has stuck with me. I've thought about that a lot, and just this summer I'm going to be taking her across the country, and in a car, and just showing her some different places, and that's really just how I've kind of lived as well. Just seeing different things, being open to different things, and it's just brought me over here on my meandering path.
For sure. Well,
Mhm.
we have to be adaptive, right? We have to kind of always change and grow and respond to different life situations and be open-minded and kind of be willing to take on
Mhm.
new challenges, which you've done a lot. Um, Well, in your work, when you said one of the things you said was you wanted to make more time to be present with families, to kind of help them navigate some of the challenges, maybe of becoming a parent, or I don't know, some challenges with maybe mothers who recently gave birth to a child. Can you say more about what kind of things did you see in your previous roles that maybe as a manager or working in a different setting, maybe you didn't have the time and space to kind of maybe address, right? Because one of the things we think about in terms of mental health is it's it's an incremental process. Most people don't improve their symptoms or their well-being overnight. They have to kind of really change how they function. Maybe they have to change their medication or how they behave or how they perceive themselves or how they interact with others, right? There's kind of a growth element there that takes time and investment and really like a presence. And it seems like that's something that you really care about. But what are there particular things that stand out to you or that you find most kind of important or that you'd like to help people with?
I think um, the ability to kind of reflect inward is just a
Okay,
hugely
for sure.
important skill. And there's a continuum, of where you might be at on that scale. And sometimes it's just too frightening to do that, or it's too sad, or there are all sorts of reasons why people may not do that regularly, like protective reasons. But I think that's just a really big issue, with when someone's undergoing therapy or even psychiatry, because you can prescribe medications to someone for, you can prescribe them all of the medications, and they
Yeah.
still m- might reach a certain point where they don't get better if they don't have the other piece where they're looking inward and trying to work on things that are holding them back. So I think that's just really important to see where someone is at and try to work at that.
That's a really interesting perspective because, right, I mean, and I'm sure you see this, Bill, as a neuropsychologist, but yeah, the idea of sort of like self-reflection, mentalization, right? We often, I think, try to do an assessment when we meet patients, where we work with them. Are they not able to reflect because of an emotional, is it more of like, do they have the capacity to reflect? Is it something emotional or based on life experience, something they don't want to think about or remember, right? But that ability to kind of pause, reflect, assess, know oneself, right? Those are, as you're saying, of course, those are very valuable skills that we try to learn and practice in mental health. And there are people come in with various capacities or possibilities for that. Um, Bill, I don't know, in your work, when you've done so many assessments, how do you think about self-reflection or sort of mentalization? Like, is it inborn capacity? Is it developed? Is it both? Something like that?
I think it's both. I think it's both a learned skill, but what Alyssa said too is the level of anxiety or stress that a person's under at a certain point in time in their life could affect their capacity to do that kind of self-reflection. If you're dealing with a life crisis, for example, or a major
Hmm.
life transition, those are really opportunities for self-reflection and growth, but they're not something that people naturally tend to do because they're trying to deal with the reality of their situation. So my question for Alyssa related to this is during pregnancy and postpartum periods, um, what do you see as kind of crisis points for some women that you typically will try and help them with? Are there trends or themes
Yeah.
that you tend to see?
Well, I think what people sometimes don't consider or have in the forefront of their mind when they're pregnant and they're about to be a parent, excuse me, maybe for the first time, is that their past will impact them greatly.
Hmm.
Mhm.
From a micro to like a macro level, like it's going to impact how they deal with labor and birth.
Mhm.
And it's going to impact how they parent, even if they think that it won't.
Yeah.
So really like working on things that have felt traumatic and have changed, you changed a person for the better or worse, it's just worth taking a look at and really delving into these things and trying to, sort through them so that they cause you less pain, when you're facing these new things like pregnancy and parenting.
How, in your role as a mental health provider, how do you help women and families understand that? Because that is an important observation. I'm not sure people would typically think of that. I mean, some people obviously would, but other people, other vulnerable people might not, that their history follows them. How do you
Hmm.
how do you how do you raise that
Hmm.
with people?
Well, I think if you're a good time to raise it, if you're an obstetric provider, would be when women talk about what they want for their birth, because with social media, there just are a lot of like beautiful pictures, portrayed out there for people to think, that to compare themselves to, and to that, for them to visualize the perfect birth. And so these things come up with obstetric providers where, someone wants to talk about how they want to, have labor without any pain medicine at all, an unmedicated delivery and, like a very natural setting. And they want very little intervention, but they're maybe not prepared to do that emotionally. That's a huge undertaking, and people can't really realize that when they haven't been through it before. So I think that's a really good time is in prenatal care for maybe an obstetric provider to bring up, like, have you thought about how your own, past may impact your ability to get through this? And if there's anything that you need to work on, it might be a time to touch base with the therapist and um, really like explore that more,
Sure.
like, what you want and why you want that, and what's holding you back, from getting at what might hold you back. And, how can we work on these things beforehand to try to get you closer to what it is you want.
Well, it's interesting because I think one idea you're talking about is maybe like an idealized or like a difficult to achieve scenario, sort of like a natural, I don't know, not pain-free maybe, but like intervention-free, right? It seems like sort of like something somebody might say on Instagram versus like real life, right?
And I think we see that more and more. I mean, as social media is so ubiquitous and present in all of our lives, and that's just a time where they're having a lot of that kind of filtered information, narrowed into their what they're looking at, and it's something that we see more and more in the hospital, and and
Oh,
when
wow,
I'm
I
working in
see.
that setting.
I I also want to add your answer to my question tells me how specialized your knowledge is of this area because I don't think patients nor the the kind of typical mental health professional would actually understand that process that you just described, which is why your specialty practice is really serves a much needed niche
Hmm.
in the whole arena of healthcare and mental health care. And I'm not sure people really understand that yet.
Right. No, I think you're right. Um, they have uh, there's some research that indicates, have you that, I don't know if everybody's heard of a doula, but um, doulas are people that come and support you in during labor and birth. And
Mhm.
so they've been able to show with some research that having a doula will decrease the number of interventions that you will undergo, and improve outcomes. So that's another thing that people um,
Mhm.
can look for, to increase their support. But what we're seeing is just like, there's a lot of variation in type of doula, and there's some of the trouble is that there's some anger and distrust, in the community with obstetrics and women's health medicine, and it kind of becomes a clash, between medical providers and what patients want, and they want very little, and then you might have um, it just becomes very complicated sometimes, and I think we need more talking about these kind of subjects across like multidisciplines, like, and more
Sure.
coming together, um, so that we're improving outcomes.
Right, to kind of focus more on the collaboration or complementing each other's skills or knowledge base
Right.
versus like a either or kind of one against
Mhm.
the other, so to speak.
In the sense that, like, no woman is a failure if they don't obtain these things, um, basically, yeah.
I think it's also interesting your comment about the doulas. One way to think about it is, as clinicians, as therapists, as mental health professionals, I think we often think about like emotional regulation is really important. You mentioned self-reflection as being really key, and part of like regulating one's feelings has to do with self-reflection. But sometimes we need a thoughtful other, like a doula or mental health professional, who could help us sort of be attuned to our needs, our feelings, our fears, so that to kind of, it could be to calm oneself or to know when to ask for help or to know when we don't know something and we need additional resources, right? So that's interesting that you said that, because that's like a kind of like an emotional assist. I mean, maybe assist in many ways, but there's like an emotional element there of hopefully a calming, thoughtful presence that allows one to I don't know, get the help they need or the services they need, or be able to have a baby and kind of be in a good
Hmm.
setting to do that, right? Seems like there's like an emotional regulation element there.
Absolutely, like a trained support,
Yeah,
mhm.
yeah, that's interesting.
Alyssa, how would a woman know or reach the decision that she needed or could benefit from the specialty care that you can offer? I mean, are there red flags for a woman to know
Hmm.
I need a specialized kind of help with this?
Yeah, I think any trauma, and we talk about the big T or little T, like any major traumatic events, or even like minor, more minor ongoing ones that are getting in your have changed your outlook, or affected you, anything like that, I think is worth coming to see somebody like before pregnancy or during pregnancy to talk about and work on those issues so that they don't become an issue, later on. And people that have lost people, if you've lost a parent, or anyone close to you, those kind of things are going to show up, in these times when you're bringing a new human, into the world.
Hmm.
Just anything in the past that has been difficult for you, or mental health challenges. Absolutely, because pregnancy changes your body quite a bit, and it changes the course of mental illnesses as well. So that would be a good time to be um, in touch with an expert.
And I think to go back to something you said, Alyssa, sometimes I wonder sometimes, maybe sometimes parents are surprised by how they're passed. They maybe it wasn't something they considered until they had children, then they kind of, like we were just in a case conference the other day where a therapist was working with a child, and the parents, when they were meeting with the therapist individual, kind of for the parenting meeting, were talking about their own influences. Both parents had like kind of a neglectful childhood, and they both had like an absence of thoughtful adults, and so they could kind of tell how much that was influencing the way they were being. They didn't know how to do it differently, maybe, but they were sort of aware of or realizing how much that weighed on their decisions. And I think sometimes we see people who are kind of well aware of that, and then they're sort of anxious ahead of time, before becoming a parent. Sometimes maybe they don't realize it until, I mean, hopefully they realize it at some point. The worst case probably is a person who's a parent who maybe is not at all attuned to what they're like, right? Or maybe some of their not so helpful, maybe helpful, but maybe not so helpful influences.
Hmm. I think that's huge. I think you're ahead of the game if you're aware that that's going to be a problem beforehand, because I think that we before we're parents, we think that we're not going to act a certain way if that was how we lived, and you're like surprised that you you still do. So I would say that that's the more common scenario, to kind of not expect it and then be
I see.
unpleasantly surprised afterward that you're doing the same thing that you were taught, sometimes in a
For
not
sure.
ideal
Maybe
way.
like, right, it sort of re-evokes those feel unwittingly sort of brings up those kind of reactions. I mean, and
Hmm.
sometimes I hear patients say they don't want to have kids because of what their own, maybe they could make a good parent, but they're sort of afraid of, well, they were raised a certain way. They're afraid of kind of becoming a parent, partially because they don't want to reenact kind of what their own childhood was like, right?
Hmm. I think that's really astute, that they're realizing that that may be a pretty big issue. I still think that you can achieve, that if you want to, and like with like talking through it and staying open and seeing yourself, you can be successful. But it is, I think, a real issue.
For sure.
Mhm. And then when you have
Alyssa,
two
do you,
people, I'm sorry, Dr. Bloom, but like when you have two people, that's
Yeah,
even harder with
right,
separate experiences and history.
right. Different histories for sure. Go ahead, Bill.
I was wondering if you see a difference with in it where the pregnancy is planned and wanted versus a pregnancy which is unplanned and the mother might have ambivalent feelings even about the pregnancy.
Yeah, I think that does happen. I almost want to say this may sound not intuitive, but that the person with ambivalence may do better than the
Hmm.
person who's
Wow. Okay.
unaware, just because it's awareness, right? It's an honest expression and assessment of the feelings, and it's just another way of looking at things and realizing. And sometimes when we paint, when we want something so badly and we idealize it, um, and make it a perfect, picture, it's just a little bit harder to deal with the reality. Um, so yeah, that's where my
Uh,
mind went on that.
that that is a very thoughtful, unexpected, but a very thoughtful answer. It's the level of self-awareness and the capacity for the person to tolerate different feelings
Right. And,
that
and the honesty with that. Yeah.
and the honesty with that. That's a great. I wouldn't have thought of it that way. That's really
Yeah.
helpful.
No, I appreciate that too because it's like and maybe like a willingness to even work on some of the
Hmm.
things that are challenging for them or whatever kind of ambivalent feelings they have to be more open to trying to understand themselves or understand how that
Yeah.
affects their decisions versus somebody who I
Right.
mean it'd be hard to have any relationship with anybody that has zero mixed feelings. So it's kind of that's it. Yeah, I think that's really thoughtful.
Hmm.
Um, one question I wanted to ask is you have because it seems like you in your work you really want to focus on the there's like the let's say medical medication part, but also like a therapeutic element. Um,
Hmm.
and you have some experience with accelerated resolution therapy, ART. Can you say maybe both for me but also for our audience, like can you give a sense of like what that work is like or how that informs your practice?
Hmm. So I um, think of it as like a cousin to EMDR, although I don't. Lily Rosenzweig, I'm probably saying that wrong, but she's the founder of Accelerated
Mhm.
Resolution Therapy. She probably would not like that to identify it as a cousin to EMDR, but really it is the similarities are that, you use eye movements while you're processing memories, traumatic memories. And art is different from EMDR in that it's often like it's a more focused
Okay.
intervention. So EMDR, I think, is supposed to be done over 12 sessions. And art is a smaller, more like, 1 to 5 sessions. So, and they use visual imagery um, and kind of like a reworking of imagery, while you're doing eye movements to process traumatic memory. Um,
To kind of be in tune with some of these traumatic past experiences and then make them more manageable or kind of more digestible, more understandable somehow.
yes, less evocative. Like when you're thinking of the memory or the memory comes up, that you don't have the same hyper arousal or emotional response to traumatic memories, and you're able to be more emotionally regulated, less triggered, basically.
I think what's so interesting about the things you're saying is a lot of times, at least um, from my point of view, I think many times when somebody is going to work with a psychiatric professional or a nurse practitioner, I don't know that they're expecting the professional to be as psychologically minded kind of as you're, not because the person can't be, but maybe they're thinking about them more as like, oh, this is a person who's going to help me manage my medication, or they'll know about my symptoms, but they're doing like I think the stereotype of a psychiatrist, for example, is not necessarily somebody who spends a lot of time with the patient in today's world, but like more doing an evaluation, maybe prescribe medications. But I think you're describing a much more holistic, emotionally attuned, sort of like self-reflective, like a different process of really truly getting to know the person, helping them to know their own feeling states and how they deal with situations. Could be parenting, could be some other aspect of their life, like a very a more balanced. Not that I'm not saying
Mhm.
nobody else could do that, but
Yeah.
that's a really I think a maybe not what one might anticipate from working with a person who also prescribes medication, because typically we almost have like a divide between kind of
Mhm.
prescribers and sort of therapy practitioners, right?
Hmm. Yeah, thank you for saying that. That's very nice. And I think that's kind of the beauty of a psychiatric nurse practitioner. I think that's
Hmm.
where there are many different types of mental health professionals, but we really are trained in both. And it makes me feel really happy that I ended up in this pathway because, just kind of almost when I think about being a young person and kind of, stepping out into your career, I feel like this all happened by accidentally almost. I don't, but just the real meandering path that I kind of talked about. But it does, that's the happy part of kind of finding this because I think it suits me well and it suits a lot of us in this way. Well, or to have this background.
Right.
Hmm.
It's a nice way to kind of bring together both what it kind of combines your life and professional experiences, and hopefully for the patient also kind of brings together different aspects of their life in a way that could hopefully make them more, I don't know, create more of a sense of well-being, or better ways to kind of manage their life. And we often sometimes people ask me like what kind of therapy I do. Well, ultimately, I think therapy is geared towards a better quality of life, better relationships, or taking better care of oneself, or right. I mean, it's not always easy. It's kind of could be hard to get there, but the long-term goal hopefully is like a more meaningful, more rewarding, hopefully more satisfying kind of life experience.
Hmm. Absolutely.
We do have at least one participant. So if anybody in the audience wants to, if you want to ask a question, or if there's something in particular that kind of strikes your interest, you can use the Q&A function. It's anonymous. Nobody sees your name or anything. You could if you want to ask a question, please feel free. And I'm sure Alyssa or Bill or myself would be happy to kind of. Sometimes that brings out different perspectives we may have not considered, or questions that people in the community might have.
Hmm.
Um, Well, it seems like one thing you really care about, Alyssa, is kind of collaboration, cross collaboration with other professionals, right? I mean, I get the sense that you really value, like, for you, having sort of professional relationships with people from different disciplines and being able to ask them things that they do, or kind of collaborating on patient care seems like that's also something that you value a lot as part of the work, kind of your way of being a professional.
Hmm. Definitely. I think that's my second job at as a midwife was at Corewell Health and Royal Oak, and it's just more of a high level setting for obstetrics. So I would attribute some of that positive, a regard for my time there because it truly is a multidisciplinary, setting where you've got a lot of expertise around in different areas, and midwives have a certain expertise too, and they're present there all of the time, which has just we're all kind of learning from each other and contributing in our way to make things best.
Sure,
Hmm.
makes sense. Do you still is working in Spanish still like would you see people who are Spanish speaking like as a patient? Is that still something that is part of your practice, or maybe not as much,
I mean, I think I could. It would be challenging, but I think I could. I'm not, I think it would be a little bit harder a mental health appointment than it was in obstetrics, because we're having a lot of similar conversations, daily in obstetrics, and it was exhausting, sometimes to have my brain, working there. And I think it would be a challenge, but something I'd think about.
And that makes sense. I mean, I come from Russia, so I speak Russian, but working as a therapist in Russian is very different in some ways than most of my
Uh-huh.
work as a therapist is in English. So most of my vocabulary as a
Yes.
professional is in a different language. So yeah, I can kind of understand what you mean.
Hmm. I think when I
Um,
needed another challenge, I might.
that's great. Well,
Good thing
you're
to
good at
tackle when.
taking, yeah, you have a track record of taking on new challenges and doing well. So that's something that maybe you could do if you choose to.
Hmm.
Um, well, we
I,
talked a little. Go ahead, Bill. Yeah.
well, I have a question. Um, where do men fit in to your
That's a good
model of
question.
care?
Hmm.
Uh, Husbands, partners,
Hmm.
sports. Yeah.
Yeah. Well, they're fitting in more now than they ever did in the past in my work as a midwife, although they were, still definitely part of family puzzle. And there's lots of data out there that says that some of the things that happen to women in the peripartum mental period happen to dads too, just because, it's not just about physiology, like the mental health challenges we face in pregnancy. It's just about like your
Life
major life
change.
changes as well. Yeah. And stress and, all sorts of things. So, you know, as as a midwife, I always enjoyed kind of bringing people into the picture sometimes, because I feel like, a lot of times you'd see a dad like being off in the corner and not really knowing, what to do. So that was just something that I did every day. I thought, like, here's, come here, like, here's how you can help, and show them certain things to do to help them get by, or just try to help people, feel included more. Um, but yeah, I think, they definitely should be paid to what changes like fathers go through in these times just as much as women.
Mhm. Yeah.
Hmm.
I think there's so many um, variations of what family structure looks like. It's, kind of these days. There's, becoming a parent through surrogacy, for example, right? Or there's so many different types of parenting roles. Do you see that in your work as well? I mean, you know, like a kind of I don't know, different family structures or different definitions of what a partner could look like in raising a child. Like, I'm just curious about your perspective on that.
Hmm. I think definitely there's a lot of families have evolved, and they look different than they, did for sure 50 years ago or 100 years ago. And just, not making assumptions as a provider about anything, and just, taking the opportunity to learn about each unique family, like where they come from, is just really important for respectful, compassionate care.
Sure. To go back just for a minute about what you said about kind of like a change, right? What do you notice in terms of what are some of the challenges that people deal with in terms of this kind of change in their identity or their life? They become a parent.
Hmm.
It's a different experience for them. What do you notice? What do you see as some of the challenges they face in terms of their identity or their kind of like change in their own life to being responsible for another person? You know what I mean? Like, I'm just curious if you could say
Hmm.
more about that.
Um, well, I think it relates to what we had been talking about before with trauma, like and awareness, and just kind of knowing, like, um, how much you're ready for it, and how much you'll have to be willing, to change to accommodate it, because it's um, all encompassing, right? And it probably should be. It's just a really big deal. And there's so much that you go through physically. It's so tiring, which I think we all, like all the parents, know how exhausting, it is. And you can't really put that into words for someone that's about to experience that, and like how it challenges you, like physically and emotionally. And then, just trying to be the best version of yourself takes a lot of, time and effort at looking at yourself and looking what you're doing, and your role of parent, of being a parent, and, kind of being willing to see yourself afterwards and make changes that need to happen and evolve, basically.
I think it's one additional kind of question I have is a lot of times in the world of therapy, we sometimes think about, like, if we're working with an adult or it could be a child, we think about the influences on the person from their family, from their parents. But I think you're talking about another very important perspective, which is support for the parent themselves. The parent is also, a person who has dreams, ambitions, feelings, struggles, right? That the parent, their experience and having some kind of like supportive structure or opportunity to kind of either work on themselves or make improvements in their own life is also really, that's also so valuable because maybe they could be more available to their child, for example, or just kind of take better care of themselves or make some
Mhm.
kind of productive changes, right? Um, I think there's more kind of like I see a lot of times in the news or articles, people writing about the parents' experience or their not only helping the child, of course, but also the parent themselves in their own kind of life journey. And it seems like
Yeah.
that's something you care a lot about.
Oh, absolutely. Because you can, make changes. I think, I don't know, people should feel empowered to try because really can be successful, with help and guidance and making these types of changes.
For sure. I mean, we often talk, many times when we do these podcast episodes, we kind of talk about topics that are like a couple months ago we talked about eating disorders or difficult kind of like when food or eating kind of becomes a problem. Well, we
Hmm.
try to also emphasize that yes, knowing about these difficulties is important, having awareness or kind of self-awareness, but also knowing that being able to get help and making changes and sort of improvements is also a real possibility. It's not just like it doesn't have to be like a perfect outcome, I guess, but that there are reasons to be hopeful that somebody could make productive, meaningful modifications to some aspect of their life and kind of have like change their experience, right?
Absolutely.
That's
Yeah,
what makes, I think, our work kind of rewarding. Go ahead, Bill.
Hmm.
yeah, no, kind of related to that. I don't know if you remember, Alyssa, but I had referred a patient to you. It wasn't one of my patients. I was supervising a psychologist who had a patient who appeared to have been going through postpartum depression.
Mm.
And that person never did follow up with care
Hmm.
for
Hmm.
that problem. I wonder if you could comment on how someone would know the difference between sort of the postpartum blues, that
Hmm.
moodiness that sometimes will occur, versus a kind of a critical mental health crisis that we would
Hmm.
call postpartum depression. Can you help us understand the differences in what's available to help women who are experiencing that?
Yeah, I think that's a really good question and so important because, um, when you're in the depths of something like that, it can be so isolating and difficult, to see past or see your way
Yeah.
out of. Um, and what happens, physiologically after during pregnancy, the hormones increase, estrogen and progesterone, and then after pregnancy, they drop drastically. And if you're a person that's susceptible to those kind of, um, serious changes, then, you're more likely to get, true postpartum depression. And baby blues are usually more transient, and contributory would be like, lack of sleep, and milder, where you maybe like are a little bit tearful, um, and you don't really know why you're crying kind of thing. And that happens within a few days after having a baby. Things have changed and, you're suddenly awake for all of these hours and, trying to keep this little human alive. Um, and postpartum depression just really is more severe, and may happen a little bit later. And probably if you've had troubles with mental health illnesses before, you're more at risk for postpartum depression. So that's one way you can stay ahead of it, is just by knowing that your risk is increased, and having other people know, around you, and can help trigger like the having a plan for how you're going to proceed, um, would be important in those cases.
Are women who've had a postpartum depression with one pregnancy more likely to have it with
Yes.
subsequent pregnancies?
Yes, but not 100%. Could be circumstantially um, contributory. With maybe like if things are better in life and less stressful next time, you can avoid it. But a lot of the times, it's a biochemical, tendency with neurotransmitters and receptors, and that make you more susceptible. So it may be hard, to get through without medication.
So, what are the typical treatments? I'm not asking specific medications, but what can you do to help a woman going through postpartum depression?
Well, there are certain medications that we would recommend, just similar to what you'd recommend with a depression episode. And there's a new medication just specifically FDA approved for postpartum depression,
Okay.
which has some really good results and data with it. So it would be great to recognize it quickly and seek some help so you can try that medication that's used specifically for postpartum depression. Um, but
And that's something that you would be able to prescribe and monitor?
yes,
Yeah.
it's a
Oh, okay.
14-day course of oral medication. It used to be an IV medication where you had to be admitted to the hospital when you had it. But they've discontinued the IV form and now have an oral form. And
Okay.
it's similar to one of the hormones that drops drastically
Okay.
after birth. So, and it acts similar in a neurotransmitter way to the hormones. So it's
Okay.
a great medication. Uh,
Good to
can,
know.
yeah,
Okay.
really help some people.
Yeah.
Yeah,
Yes.
I
Go
I
ahead.
think the anybody who's kind of listening to this podcast or who would watch it when we record it, I think I could tell that they likely would feel very comfortable working with you, Alyssa, because of your kind of broad thoughtfulness and understanding. I could see how somebody might feel really reassured hearing you describe your various professional experiences and perspective. They might say, "Wow, you're someone that they could talk with openly and feel kind of confident knowing that you could be helpful or that you could kind of be a great resource for them." So this is like in a sense, it could be like a very reassuring conversation for the listener about these kind of topics.
Sure. Yeah.
Thank you. I do try to be really thoughtful. These issues are really important, and it's just really important to know somebody and make sure you're on the same wavelength, and that they have you have buy-in from your patients about what you're asking them to do, that they agree with you, and so it's just really important to get to know where people are and go from there.
Yeah, communication, right?
Hmm.
Yeah. Yeah.
Yeah.
Um, well, I mean, I think that covers a lot of kind of the topics we were hoping to get into. I don't know if Bill, if you, anything else that maybe, or Alyssa, anything else that we kind of didn't ask you about that you think would be helpful for a listener to know?
Um,
Mm.
just would just really want people to encourage people, if they take anything home with us, just to be proactive and to work on anything that may still be lingering, when before or during when they're meeting these life changes and challenges. And that would be my recommendation. And
Sure. No, I think that's a great point because yeah, being proactive and seeking help and kind of being an active participant makes such a difference, right? Sometimes people ask me like, well, can therapy be effective, for example? Well, it's treatments are usually most effective when the person takes a collaborative, proactive role. If they're able to participate and kind of, be involved, both the provider and the patient, the likelihood of a better outcome is usually higher. So.
Hmm.
Well, Alyssa, thank you for, I think this is a really nice conversation, and I know that people will appreciate hearing kind of your perspective. And Bill, of course, thank you for your questions. So it's really great to kind of get to know more about your work, and we're going to share our this podcast episode with our existing patients, and I think there's a lot of people in our community who it'd be so great for you to connect with, like other clinicians and providers who may not have your area of expertise or could kind of collaborate with you. So I think there's a very kind of
Mhm.
promising avenues for helping more patients. So
Yeah. Yes, thank you for having me.
for sure.
Good.